Welcome to Alivio Physical Therapy. My name is Dr. Anthony Hillebrand. I am the physical therapist here. So I would like to start a little bit of series because, context is everything. Put yourself out there and figure out who you are is kind of the scope of this, and let people know. Because, as a physical therapist, people, come to me, they're in pain. They don't move well. They can't work. When they work, they have too much pain. They have a hard time taking care of their family, things like that. So, people ask me, where does my compassion come from? Why do I care so much? I get this a lot. Like, why do you do all the continuing education that you do? Why do you take all the new courses? Why do you get the new certifications? Why do you explore these new areas that traditionally people are scared to go into? So the first story I'll start with is me as a patient. I was a sick kid. I was diagnosed with asthma at age 6.5, 7, give or take. I was diagnosed at the best place, I guess, theoretically, outside of a hospital you could be diagnosed at. I was at the picnic for a hospital that my parents worked at, because my parents are both nurses, surrounded by nurses and doctors. I developed a lot of thirst. I started turning a little blue. One of the doctors came up to my parents and said, "Hey, does Anthony have asthma?" My parents was like, "No." Doctor's like, "Well, you probably ought to take him to the emergency room because it looks like he's having an asthma attack." So that was like a 10-day stay in the hospital the first round. So adjusting to life with asthma. So for the next 6 years, I was in and out of the hospital with either severe asthma attacks or pneumonia, a weird virus in there. So I spent a lot of time in the hospital, which is probably why I have no problem walking into a hospital now. I guess some people go the other way, but for me, it's like, been here, done that, have the t-shirt, so to speak. So that was my first bout of a significant illness. And it took a while to get things under control. But then, at the age of 13, I was diagnosed with a very rare form of cancer. It was caught during an eye exam, actually a recheck for contacts. Nothing there the week before, came back to get checked because I had gotten contacts because I'm like, hey, I'm 13, I wear contacts. So then the doctor's like, something's in there that wasn't there last week. So I got sent up to the University of Iowa Hospital. We went through a couple of lovely tests. For the squeamish people, I won't tell you what the tests were, but there were lots of scans and things like that. Which gets me to why I treat patients the way I do. So, I was pretty sure after that first trip up there, given the fact that all these specialists, the doctors with the lab coats and the gray hair, I wasn't seeing the interns, I wasn't seeing, the residency students initially. I was seeing the top people. So I'm like, okay, this is probably pretty serious, and given where it is, where it's at, I'm pretty sure this is a cancer. So go up there, a couple of tests. So they do a biopsy. They discover, yes, it's cancer. It's a rare form called ocular melanoma. So this leads me to how I officially found out. So doctor comes into the room and asks me to go sit in the hall. Now I'm 13 years old. This is a at this point, this pretty much confirms what I know the diagnosis is. Because you don't have somebody go sit in the hall, tell their parents, oh, everything's good, and then bring them in and say, oh, yeah, by the way, you're fine. So I have general issue with that. But then I get called in. It was like 5 minutes, maybe. It's been a while. I might be off my time frame, but it was at least a few minutes. I don't think it was more than 10. And of course I come in. My parents are crying, and doctors, upset because you don't want to tell a 13-year-old they have cancer. And he proceeds to tell me. I'm like, okay, so what do we do? He's like, well, we could try chemotherapy and radiation, but where it's at and the fact that it's growing so quickly, probably not the most effective way. So the only option we have to ensure the highest amount of success is to remove the whole left eye. So I do have a prosthetic. I'm like, okay. So, followed up by the next issue. So whenever you get a serious diagnosis like that, the last thing you want to hear is how rare it is. Because it doesn't matter how rare it is. If you have it, you have it. It doesn't like, well, there's only a 1 in 3 billion chance you're going to get this conversation. It's, well, I have it, so I am not 1 in 3 billion. But I was told that the usual patients who they see with this are elderly, blue-eyed, blonde-haired women. Now, I mean, granted, my goatee is getting a little gray, but at 16, no facial hair, more hair than I have now, not blue-eyed, not a woman. So that annoyed me. 13-year-old, I'm going to get annoyed. But I kept it to myself. But that kind of set me up to how I view interacting with my patients now. If a patient has something, we're going to talk about it. I'm going to talk to the patient about it, even if it's a kid. Now I'll change my terminology and, but we're going to have that open conversation. I mean, I had a 8-year-old the other day, and it wasn't anything severe, nothing life-threatening. She bounced back well. I think I saw her like 3 times. But, I talked to the patient. I talked to her. I treated her with that respect because that was something when I went through my cancer process, I did not get. And to this day, it still bugs me. I don't know if you can tell, but it does. So that's how I treat every patient is I'm going to get your input. I'm going to treat you like a person. I'm going to treat you with enough respect that I'm here with you. And I truly want you to succeed. I want none of my patients to fail. When I have to just, throw up my arms and I can't do anything with you, that's a bad time for me. And I don't get that way. There's always something we can try. There's a different, if you're game, we're going to go for this. So that's what we're going to focus on going forward. So let me take a quick pause here because I don't want these to get too long, and then I will be back.